action plans. And what I'm hoping is it will give you an idea of what a COPD action plan is, why you want to have one in place, and when is the best time to use it. Oh, stop there. All right. So we're doing the what, why, and when of a COPD action plan. And my name's Tammy Weagle, and I'm a registered respiratory therapist, and I'm also a certified respiratory educator. So I think what's important to do is to explain the difference between a nice healthy lung and a lung that is affected by COPD, so that we can understand why when you guys get sick with your breathing, it happens so much faster and it happens so much harder than on someone else. So I'm going to explain a good healthy lung, and then we'll go into a lung with COPD, and then we'll get into the COPD action plan. So with a good healthy lung, as you know, we breathe in through our mouth or our nose, and the air goes down our windpipe, or our trachea is the fancy name for it. And then the airways branch off into a left and right lung. And the airways keep branching off, and they keep getting smaller and smaller. So I tell people it's kind of like a tree. You have a tree trunk, and then you have the roots to the tree underneath, okay? In the airways, so this is a picture of the airway. They're normally nice, big, I tell people they're like a garden hose, and they have little muscles around them because those muscles are there to keep your airways open. If you didn't have those muscles, your airways would be floppy and they would flop shut. So the muscles are there to keep the airways open. At the very end of the smallest airways, you have these tiny little air sacs, and they're called alveoli, but air sacs is the easiest way to remember. And the air sacs are covered by little tiny blood vessels. So what happens is when we breathe in room air that has 21% oxygen in it, and the air travels down to those air sacs, and the oxygen travels through the air sac into the bloodstream, and then your heart pumps that oxygen around for all your body to use. So every muscle and every organ takes oxygen to work. And when they use up the oxygen, they produce carbon dioxide, and then your heart pumps that carbon dioxide back to the air sacs and you breathe it out. So you're breathing in oxygen, your body's using it up, producing carbon dioxide, and then you breathe the carbon dioxide out. So those are good, healthy lungs. So now a lung with COPD. As you guys probably are aware, COPD stands for chronic obstructive pulmonary disease. I tell people that's still a bunch of words just thrown together. So I like to break it down a little bit more. So chronic means once you have it, it never goes away. So I tell people it's kind of like chronic back pain. Your back might always feel a little bit sore. Sometimes you're going to have a flare up and it's really sore, but it's always there. So chronic means it never goes away. Obstructive is a blockage, and pulmonary is your lungs. So it's a never going away blockage in your lungs disease. But what's causing that obstruction or what's causing that blockage can be a few different things. So with COPD, you can have two issues going on down in your lungs. You can have what we call chronic bronchitis or emphysema. So a lot of people have heard of bronchitis, and you may have found that you had a lot of issues with bronchitis when you were growing up. And bronchitis is basically you have inflammation in your airways so that they have swelling and a lot of mucus production. Chronic bronchitis is inflammation of the airways and mucus production that never goes away. So instead of having these nice big airways, big garden hoses, because you've inhaled an irritant for so long. So it doesn't have to be cigarette smoke. It can be an irritant of any kind that can cause this issue, but it's over a long time. Most people in North America, it is because of some type of cigarette or secondhand smoke. So what happens is your airways are in a chronic state of inflammation. And if you have inflammation, you have swelling of the airways. So instead of having these nice big airways, you have swelling that makes them smaller or makes the obstruction. And you also have more mucus production. So the mucus also clogs up your airway. So it's that swelling of the airway and the mucus production that causes the obstruction in the COPD. The other thing that happens is emphysema. And with emphysema, what happens is those little air sacs, they become damaged. So now they can't carry the oxygen into your system as easily, and they can't carry the carbon dioxide out of your system as easily. So people that have emphysema or severe emphysema are the people that you'll see on home oxygen. So people with chronic bronchitis and emphysema are both breathless, okay? The symptoms are the same, but how we treat the symptoms can be different. Chronic bronchitis, those little air sacs aren't damaged, therefore you don't need to have oxygen. And with emphysema, those air sacs are damaged, so we treat people with oxygen. So that's kind of the difference of what's going on down there. And a lot of people will say, well, I know somebody that has COPD and they were allowed oxygen and I'm not. It's because what's happening in the lungs can be two different things. The other thing that can cause an obstruction is, as you can see in the picture of the airway, the muscles around the outside aren't working as well as they can. So the airways actually flop shut a lot easier. So I tell people your lungs like a balloon. When you breathe in, the balloon inflates. When you breathe out, the balloon deflates. When those airways are flopping shut, it's like pinching the balloon in the middle. So you can breathe out this air here, but you can't breathe out this air here. So you get your next breath in, it can't be as big and as filling as you want it to be because your lungs are already half full. So the obstruction is caused by inflammation, by mucus, by muscles not working as well, and those little air sacs are damaged. Okay, so that's what's going on. So now move on to the action plan. So I like to explain what an exacerbation or a flare-up of your COPD is, because this is when you are going to want to know why you would want to use your action plan. So a flare-up of your breathing actually causes more inflammation in your airways, and you also produce more mucus. So I already said that most people have nice big airways. Your airways are already smaller because you have the chronic swelling and the chronic mucus. Now you get a chest infection on top of that, and you get more swelling and more mucus, and your airways could clog off even more and cause you more breathlessness. So it causes that increased narrowing of the airway, and which causes that increased breathlessness. What I like to tell people is people that don't have chronic lung issues, the doctors a lot of times will not order an antibiotic at the very beginning because their airways are so big. If they get inflammation and swelling, it puts them to where you are at the beginning. So we want to treat somebody with COPD a lot faster because you don't have the advantage of waiting the 5 or 6 days for the infection to clear your system on its own. So we want to make sure we don't make your airways clog off completely and give you a lot of distress. Also on that note, if you've ever been in hospital because of your breathing, you may get oxygen when you're in hospital. And that's because when you're in a really bad flare-up, those airways clog off completely. So the oxygen can't get through the clogged off airway to get to the little air sacs. So they give you oxygen, they give you antibiotics, they give you prednisone, and your airways go back to your normal. And then you get the oxygen taken out because now you're breathing back at your baseline. So that's why sometimes in hospital you might get oxygen, but at home, you don't get it. So different triggers for an exacerbation. So stress and emotions, as you guys probably know, when you're having a worse day, sometimes your breathing can be affected. Different viruses such as the cold or the flu or anything can cause your breathing to be worse or a flare-up. Weather changes, so going from humid days or hot days, or sometimes the really cold, everybody's a little bit different, but a lot of people with COPD find weather changes very difficult. Scented products can be a trigger for somebody's breathing to be in a flare-up, and different air pollution can be as well. So why do we want to treat an exacerbation? So we've kind of touched on that. So frequent or prolonged flare-ups can cause an increase in symptom burden associated with COPD. So if you're constantly having flare-ups, you're going to have changes in your breathing that stay with you. So we want to make sure that we keep you as healthy as we can by not having you flare up as much, or for you to treat a flare-up a lot faster. So the symptom burdens that you may see if you're having chronic or a lot of flare-ups is the increased breathlessness that never kind of gets back to the baseline that you're at now. If you're that breathless, your activity level is going to be decreased because you're not going to want to do as much because you are so breathless. And then that can cause the increased anxiety, because what you were able to do 6 months ago, you find twice as hard to do now. So we want to try to prevent you from getting to those stages. So how do we do this? How do we treat an exacerbation or a flare-up? And you'll notice I have the name exacerbation up there. That's the big fancy medical term for a flare-up. So a COPD exacerbation is a flare-up of your breathing. So how do we treat it? It's with a COPD action plan. And the COPD action plan, you're going to see different versions of it, but they're all telling you the same thing. This version has been put out by the lung associations across Canada, and it's also supported by the Canadian Thoracic Society. So the Canadian Thoracic Society is respirologists throughout all of Canada. So the lung specialist doctors have put this together to say this is the best way to treat somebody. So this isn't something that just kind of got pulled out of the air. There's been a lot of knowledge and brains put in behind an effective action plan. So the action plan is actually in 6 pieces, and I'm going to break down each piece. So the first piece is information. That's your information. So if a doctor sat down and did this with you, he would sit down or she would sit down and say, so what are your goals? What do you want to happen by having this action plan put into place? So everybody's goals may be different. Your goals may be that you don't want to end up in hospital. Your goals may be you don't want to have to be on antibiotics all the time, or you want to prevent your lungs from getting worse, and hopefully meaning that you're not going to have to require oxygen down the road. So this is kind of the information you'd put here. The support contacts area. So as mentioned in the past, I'm a respiratory therapist that works for a program called the Inspired COPD program. So I put my phone contact information on a patient's action plan so that they know they can contact me. And I've also normally put their family doctor's name and phone number there for a contact. So the other parts, I'm just going to show you. So there's 1, 2, 3, 4, and 5 more parts, and I'm going to explain those in more detail. So the first part is, as you see, the different parts are colored. So there's green, yellow, and red. I tell people it's like traffic lights. Green, you're doing good, keep going. Yellow, not doing so great, take a little caution. And red means stop what you're doing and go get help. So the green area, what we look at is what your sputum is like on a good day. So your normal sputum color. Some patients have no sputum. Some patients have a lot. Some have it, the color of it might be clear. Some might have a light yellow. So you kind of need to know what your normal sputum is like so that you know when it's changing. Same with some people might find that it's really easy to cough up, but then it might become difficult. So all of those things are what you want to recognize with your sputum on your good days. The other thing the action plan looks into is what makes you feel short of breath. Again, everybody is completely different. And sorry, I'm talking and there's actually points that I was going to put here. So everyone's sputum is different. And what activities make you short of breath? So some people are short of breath when they're climbing the stairs, and that's the only time they get winded. Other people just walking from their couch through their kitchen makes them short of breath. So again, kind of need to know what your breathlessness is on a normal day. And then your actions. So what do you do to keep yourself feeling well? So you're going to use your daily puffers as directed. So whatever medications you're on, you want to make sure you're taking them routinely and as prescribed by the doctor. And then again, as mentioned, some people are going to be on home oxygen, but not everybody is. And the things that change of why you would need to be on oxygen is the severity of your COPD, if it's chronic bronchitis versus emphysema. So those are things that we would look at. If you're not on home oxygen, then I just put an X through that section because it doesn't pertain to you. The next section is the yellow section, the cautious section. So I feel worse. So this is where the big chunk that comes into place, because a lot of people don't have this yellow zone planned out for your COPD. So what the yellow zone is you're going to notice that you have 2 days of changes in your sputum. Okay, so we do recommend that it is 2 days. You don't want to go longer than 2 days because it will take you twice as long to bounce back to feeling better. But you don't want to rush to it either. So some people might just cough up. I tell people you might cough up a fur ball that's darker than normal or thicker than normal, but it's only a one-time fur ball. So you don't want to jump right on the antibiotic. But if you notice you have changes in your sputum that are consistently different, then we would want to go down to what we're going to do. The other thing that we look at is, are you more short of breath than usual for at least 2 days? Okay. And you may also find that you have increased cough and or wheeze. So changes in your sputum, changes in your shortness of breath. And then also if you find that your cough has changed or you're more wheezy, those are all kind of differences we would see when you're in a flare up. All right. So if I've checked yes to one or both of the above, I'm going to use my prescriptions for COPD flare-ups. What are your prescriptions for COPD flare-up? That is your antibiotic and prednisone. That is the big chunk of what an action plan is to have an order sitting at your drugstore for an antibiotic and prednisone so that it's there for you if you need it, okay? Because normally what happens is people go from the green zone to the red zone, which means I'm feeling good, I'm feeling crappy, but I can't get into the doctor for 3 weeks, or I'm not sitting in the emergency room for 6-10 hours. So they just stay at home and suffer it out until they can't suffer it out anymore and they have to go to the emergency. So this yellow zone kind of gives you something to do and hopes you don't get to the red zone. So the other part of it is I'm going to use my daily puffers as usual. And if I'm more short of breath than usual, and this is a part where you discuss it with your doctor, okay? But if you're more short of breath than usual, this is what most doctors will say. I'm going to take 2 puffs of my salbutamol. So your salbutamol, your Ventolin, the blue puffer, that's what we're talking about here, up to a maximum of 6 times per day. So when you're in a flare-up and you're really breathless, the blue puffer helps relieve some of that breathlessness. And the blue puffer stays in your system for about 4 hours. So that's why it's suggested when you're in a flare-up that the doctor can prescribe it to take 6 times a day while you're awake. So every 4 hours you could take 2 puffs. But that's something that the doctor should be prescribing so that you know that it's all right to do that. The next section, I'm going to use my breathing and relaxation methods as taught to me, and I pace myself to save energy. So examples of your breathing and relaxation is your pursed lip breathing, that in through your nose, push it out through your lips. I also tell people, so an antibiotic and prednisone normally kick in within a couple of days. You're going to feel a difference. You're not going to be bounced right back to where you were, but you should see improvement in yourself. So I tell people for that day or two until you feel that difference because of the medications, then pace yourself. Don't get out of your pajamas for the day. Don't feel you have to sweep the floors or whatever until you're feeling better. So do the breathing and relaxation methods so that you're preserving some of your energy. And then the other section that's here is if you're on oxygen, to increase it. Again, I tell people to discuss that with your doctor. What I tell my patients that I deal with is if your oxygen levels are becoming affected, then we may have waited too long to start the antibiotic and prednisone. So we want to keep a bit closer on you, and you probably should go to see the doctor. But again, you can take this form in and you can ask the doctor what their suggestions are if you're on home oxygen. So that's your I feel worse zone. Hopefully, if you do everything that's put there, you start your antibiotics, you start your prednisone, 2 days later, you're going back into the green zone. However, if you don't go back into the green zone, then you're going into the red zone, which is, uh-oh, I'm feeling much worse. So the red zone is laid out and it says, if my symptoms are not any better after taking my flare-up medications for 48 hours. So You've been on the antibiotic, you've been on the prednisone, and 2 days later, you're feeling just as bad or even worse. Sorry. Or if you're really short of breath, nervous, confused, and or drowsy, and or have chest pain. These are all reasons for you to seek better medical help, okay? The increased breathlessness, the confusion, the drowsiness, there's so many medical conditions that can cause breathlessness that we want to make sure that we're treating the right thing at the right time. So again, if you've started your antibiotic and prednisone and you're still breathless, maybe something else is going on. So we want to have a more in-depth check-in with the doctor. So again, that's what call for help. I'm sorry. You're going to contact your support person or your doctor or go to the nearest ER. And I put a note here saying you don't want to wait too long to talk to your doctor. So if you have a call into your doctor, but you're still having all those symptoms, I don't think, and it would be great if doctors got back to you and could fit you in at a moment's notice, but unfortunately, I don't think for most of us that's the case. So don't wait around for the doctor. If you are getting really a lot worse, go to the emergency room. So now the next section. This is the important information that I want to point out to everybody. So it says, I'm going to tell my doctor, my respiratory educator, or my case manager within 2 days if I've had to use my prescriptions for flare-up. So right there, it's important that you let your doctor or healthcare provider know that you've used it, because they're going to want to ensure, did your flare-up get cleared up, okay? Or they're going to want to start you and get another prescription on file for you for future use. And then we also keep an eye on how many times are you using your antibiotic and prednisone. If you're using it 3-4 times in a month or two, then we got to do some more investigation. Why is the flare-up never clearing up? So those are why you want to keep the healthcare workers all in the loop of how you're doing. And then it says, I will also make follow-up appointments to review my COPD action plan twice a year. If you have a prescription on file for an antibiotic and prednisone and you have not used it in a year's time, the prescription actually expires. So pharmacies can only keep the prescription on file for up to 12 months from the time it's written. So that's also another reason why you want to just always discuss this with the doctor. So after every use and every year. And then the last section that's on a COPD action plan is a note section. So again, as a respiratory educator, this is where I'd put down a few extra little notes. So for example, I tell a person, you want to rotate between antibiotics. So if you were on one type of antibiotic and it worked well, if you're using an antibiotic again in the next few months, then you want to have a different antibiotic. You don't want back to back the same antibiotic, because eventually your body's just going to say, this doesn't work for me anymore, and you'll build a resistance. So you want to always have at least 2, if not more, antibiotics that you rotate between. Another thing that I would put up there is make sure you use the antibiotic that's in your prescription and the prednisone that's in the prescription for COPD flare-ups only, okay? You don't want to go, oh, I think I have a UTI coming on, I'm going to use that antibiotic, because a lot of different infections need different types of antibiotics. So the prescription that's on file for you is only to be used for your COPD, a flare-up of that. And then you want to make sure if you're starting your antibiotic and prednisone, you want to use it the entire thing, okay? Don't stop. If 3 days into it, you're like, okay, I'm feeling better, I'm going to save that. Don't. Because you need the full course of the antibiotic to make sure it wipes out all of the bacteria that's causing the flare-up. Because even though you're feeling better, it doesn't mean it's all out of your system. So make sure you use the full prescriptions until they're all gone. And then another note, again, that I would put on somebody is, if I look at patients' medical history, and if I notice that they have are on medication for fluid retention. So you can always ask your pharmacist if you are on a medication for fluid retention if you don't know this. Because breathlessness, because you're retaining fluid, feels the same as breathlessness because of a flare-up of COPD, but we don't treat them the same. So for example, if somebody I knew had fluid retention, or another word you might hear is congestive heart failure, I would tell them, if you become breathless and your feet are swollen and you're more breathless when you lie flat on your back, if you've gained a lot of weight in a very short amount of time, then that could be more of a fluid issue. And starting your antibiotic and prednisone won't help out with that. So making up a COPD action plan is good to do it with a healthcare member, because they can look at your whole health records so that they know the differences between all the different conditions that you may run into. So that is your COPD action plan, all put together, all those parts to hopefully help you figure out how or when to use your antibiotic and prednisone. The other thing that I like to just kind of briefly touch up is prevention, so that you don't actually get a flare-up of your COPD. Sometimes it's inevitable, but flare-up prevention can be managed. And a lot of these things you already do or you already know about, but there's a couple of things that I didn't even really consider it. So I'm going to bring them up. So of course, good hand hygiene is number one. Oral hygiene actually is really important too. So you want to make sure that you're brushing your teeth, and if you actually have dentures or not your own teeth, brush your gums as well, because bacteria in your mouth can grow. And if that bacteria in your mouth starts to slide down into your lungs, it can cause a chest infection. So oral hygiene is just as important. Sinus infections, you want to make sure you're treated for those, because again, postnasal drip with an infection from your sinuses is dripping down your airways, or it can be dripping down your airways. Having up-to-date vaccinations, very important, in hopes that you don't get sick. Avoidance. So I feel that a lot of us are doing more avoidance because of COVID, but avoidance is a good thing. If your sweet little granddaughter wants to curl up on your lap and she has lamb's legs, that's what they call them in Cape Breton, lamb's legs, for the nose running, just say, you know what, sweetie, let's take a rain check on that hug. I know it's really hard, but you need to keep yourself safe. Acid reflux, so or heartburn. If you have a lot of heartburn and a lot of acid reflux, that acid is coming up from your stomach, and your food pipe and your windpipe are side by side. So if the acid comes up from your stomach and up your food pipe, it can go down and trickle into your windpipe, and that can cause you to have a flare up, because that acid is very irritating to your airways, and it can cause them to go into spasm, and can cause them it can cause a flare up. Seasonal trends, so changes in temperature, changes in humidity, all those things. And of course, flare-up prevention, the big and best is to quit smoking, so your lungs don't deteriorate anymore. Everybody knows smoking is bad for their health, but it is one of the most addictive things out there. If you need help quitting smoking, there's different programs, and actually the Lung Association just started a new program. So that's something you can discuss. We can discuss that another time. If there are people that are really wanting to quit and not sure how to go about it, we can discuss that with you. And that is my long-winded presentation. So I'll take questions, or if you need anything clarified, I'd love to hopefully make this even clearer for you if you need me to.